Let me go ahead and get everything pulled up here, and we will keep moving along. Oh, by the way, so I know a lot of you guys had need the image reviews. Stay tuned. I'm going to be sending you guys a schedule on that. I'm going to send some of you. I'm trying to go in the order of the requests I've received. It's been a bunch of you guys. We will get them all done, I promise you, before the end of the semester. And those of you that have let me know, they will not expire because you were technically scheduled with me. So stay tuned for that. I'll be scheduling a few more of you on this Friday morning, possibly between some of the class periods as well on Friday. And of course, all next week is makeup week. So I'll be scheduling you guys next week as well, so we can catch up on those image reviews and get them all squared away. I completely forgot it wasn't makeup week next week. I was thinking we had a week of classes again, but no, that's it, guys. We're about to wrap it up. It's just finals coming. It's pretty awesome. All right, let me get everything pulled up here. Almost got it. Bear with me here. All right, guys, so we left off talking a little bit about the non-ionic contrast medium, also known as the low-osmolality contrast mediums. And if you remember, that is always going to be our preferred choice when it comes to contrast delivery. And the reason for that is, if you remember, of course, it's going to cause the least amount of reactions overall. If the patient is going to have an allergic reaction, if we're using that non-ionic or low osmolality contrast media, that type of allergic reaction that happens is going to be much less severe overall. It's definitely going to be the safer choice. Now, if you remember also, we talked about the ionic contrast mediums. We do use those in special cases if the doctor requests it, but overall, it's going to be more dangerous. And that danger comes from the fact that those dissociate into separate ions as they pass through the body, whereas the non-ionic does not dissociate, therefore making it safer overall. It's also going to be more cost-effective. We're going to have to use a lot less overall, which is a huge advantage, especially if the patient's going to have some kind of reaction. And just overall, it's going to be the most tolerable type of contrast that we use in the field of radiology. Much, much more preferred over most of our contrast mediums. So we're talking about some of the effects. We talked a little bit about viscosity. If you remember viscosity was the thickness of that contrast medium. And if you remember, the more we heat that contrast up, the less viscous it becomes. Therefore, it's going to travel a lot easier through the patient's body because we don't want really thick contrast mediums passing through the patients that, of course, could cause a lot of issues. So one thing that you'll see a lot in the X-ray departments, the CT departments, is they'll be heating up that contrast to keep that viscosity as low as possible, because once we remove that contrast medium, we never want to just go sit on a counter. Why? Because it's going to reach room temperature quite fast, therefore raising that viscosity and making it less safe to use overall. So anytime we remove a contrast medium from a warmer, we need to make sure we're removing that right before we're about to actually inject it in the patients. We don't want to just sit on a counter and forget about it. It's going to be counterintuitive. It's going to get very thick, very viscous, and we won't be able to use that properly. Now, one of the things that will happen to a lot of patients if there's going to be a major issue, in fact, this is the most common issue when it comes to having like a major reaction to a contrast medium, that's going to be hypovolemic shock. Very important term to remember there. And that's especially prominent in what we call a dehydrated patient. They haven't had enough fluids beforehand. So one of the things that we like to ensure, especially in the world of CT and MRI, is we always want to make sure those patients are properly hydrated. If they are not, they are at an extreme risk of having that hypovolemic shock. In fact, the biggest issue, like I just said, the biggest issue when it comes to injecting contrast media is a patient is dehydrated and they enter into hypovolemic shock. How do we counter that? We make sure that patient is properly hydrated. How do we find that out? Well, it comes to that question and answer period when we're actually talking to our patient, prepping them for the exam, saying, did you have fluids before this exam? Are you hydrated? If they say anything along the lines of being dehydrated or not having enough fluids, you want to let that radiologist know immediately, because they may not want to proceed with that exam, because that risk of that hypovolemic shock escalates exponentially when those patients are not hydrated properly. That's going to be a complete shock of the renal system, as a matter of fact. The urinary system is what's affected the most during that hypovolemic shock and that major dehydration that the patient is facing. So definitely something to remember there, to write down. That's going to be the most severe issue that does occur with the injection of contrast mediums, and that occurs most frequently with our dehydrated patients. Therefore, we always want to make sure that they are properly hydrated before we inject any kind of water-soluble contrast agent into their body. And of course, that's just showing you right there. We talked about hypovolemic shock in one of our past chapters. That reaction is going to be severe blood or fluid loss, making the heart unable to pump enough blood through the body. And it all reciprocates from that renal system being dehydrated, the body being dehydrated. It goes all the way to the heart, the whole body goes into shock, can't pump properly. Obviously, this is a very severe, dangerous reaction. So it really is a big deal when we talk about making sure our patients are properly hydrated. Now, it's something to overlook when we're questioning them. Now, we won't see this as much. This is more so going to apply to CT and MRI, because we deal with a lot more intravenous contrast injections in CT and MRI. But should we be doing any kind of study within radiology involving water-soluble contrast agents, we still want to go ahead and bring up the point: are you properly hydrated? Have you had fluids today? Are you feeling dehydrated? If they say yes, go to the radiologist, make sure they know about it before you proceed with that exam. Okay, so talking about some anaphylactoid reactions. These are some of the anaphylactoid reactions that can occur whenever we have contrast injections. This all comes back to making sure we're doing a proper history of our patients, making sure that we are aware if there have been any past reactions, past allergies, and even looking in their charts. But just because it's not in the charts does not mean they may not have some kind of reaction to that contrast. That's, once again, back to patient care 101. You want to never leave out a single detail when you're talking to your patient. Have you had any kind of reaction whatsoever to a contrast medium in the past? We must always ask that, because every once in a while you get a technologist, a nurse, a doctor that may overlook something, not doing what they're supposed to, and they failed to put that reaction in the patient's charts. Then you forget to ask. All of a sudden they're having extreme vomiting, cardiac arrest, something's happening. You're like, what's going on? Their chart didn't say this. But you also didn't ask the patient before. They may have brought, hey, I did have a major reaction to contrast before. If they say, yes, I've had a reaction, once again, first thing you're going to do is you're not going to continue the study. You're going to write that reaction down, bring it to the radiologist and say, hey, so-and-so here has had bronchospasms in the past. Do we want to go ahead and proceed with this exam? He'll say, well, maybe we're not going to do that today. Or he'll say, well, let's use this type of contrast because there's less a chance of a reaction of that sort. It's all back down to that communication once again, and definitely something not to overlook. We've got to be super thorough when we're interviewing these patients. So those types of anaphylactoid reactions are listed there before you. This will be urticaria. Urticaria is the fancy way of saying hives, by the way. That's going to be one of the more common reactions. Wheezing, throat swelling, also known as edema. Bronchospasms, giving them a lot of trouble breathing, nausea, vomiting, and the worst of those listed there, of course, cardiac arrests. And these all fall under what we would call anaphylactoid reactions. Okay, so back to that interview, guys. Of course, make sure you're always doing a thorough patient history. That's definitely something to never overlook. I mean, I know I keep saying it over and over again, but you would be amazed how many technologists just overlook these small little things, and that can cost you your job. That can cost you raises. That can cost your department money. We've got to always give those thorough patient histories, write everything down that the patient tells us, and make sure that we look in the patient's chart, because there can be some very useful information in that chart that someone may have overlooked. Renal function is a big deal. That relates to that hypovolemic shock we just talked about. Anytime a patient's going to come in for some kind of intravenous contrast study, they're always going to do a thorough testing of that patient's renal system. We're not going to go into all the details of that. That'll be more so when you get into other modalities, but they're going to check things like their creatinine levels, BUN levels, INR levels. They're going to make sure they're all within a certain range, because if they're not, they of course are not going to proceed with that contrast study, because there's going to be too high of a risk of having that hypovolemic shock go on. So renal function is always analyzed very thoroughly before we do some kind of contrast injection. And that relates, once again, all the way back to that dehydration principle, which can lead to hypovolemic shock. Also, a hospital is always going to consider contrast costs. As I told you guys last time, contrast is extraordinarily expensive. There are off-brands, there are cheaper brands. Depending on what your facility wants to use, they're going to go for the best cost overall. And one thing that I didn't highlight this, but it is very important. If a patient ever has in their chart, their history in their chart, or states that they've had metformin or glucophage, you must discontinue that medication 48 hours before and 48 hours after the use of iodine contrast media. Now, I didn't highlight this, but that is a very important point to remember. And the reason for that is that particular medication, metformin and glucophage, has a severe reaction with most contrast media we use, and it's a very dangerous combination. So we just always discontinue the use of that 48 hours before and 48 hours after the use of the contrast media to make sure it's flushed out of the body properly. And also, does someone have a question? Someone speaking up? I heard someone asking a question. Make sure that if a patient tells you that, once again, don't say, oh, it's fine, we'll write down they've had glucophage 10 minutes ago, let's go ahead with the study. Now, that's a huge red flag. When you see that, if you hear or see that word glucophage or metformin, you need to stop immediately and bring that up to the radiologist, because they are definitely not going to proceed with that exam. Way too dangerous a combination. So definitely something to look out for to make sure that you ask, have you had this medication in the past 48 hours?
Mr. Donahue, is it just for the metformin or any medication that helps with the sugar?
Sorry, say that again?
Is it just for the metformin or any medication for their diabetes?
It's specific. There are some other combinations, but this one right here is especially dangerous, the metformin glucophage. The other ones, they don't have as much of a reaction. This would be the dangerous combination right here. So definitely a big no to metformin and glucophage. There's obviously, there are thousands upon thousands of combinations the way drugs react with contrast media. We could spend an entire semester listing those. But this is the big one right here that we need to make sure we look out for. Also, because it's a lot more common that we're going to see that medication in a lot of our patients. Okay, so when it comes to reactions, guys, we're going to start listing some of these reactions. We're going to classify them in the mild, moderate, and severe categories. So when it comes to a contrast reaction, big bold point there, most generally, most often, those reactions will occur within the first minute of injection. Does not mean that they're not going to occur later, but most commonly, at 1 minute, we're going to see most reactions, whether it's moderate, severe, or mild. That's the most common occurrence. They can be very unpredictable, obviously. Sometimes we don't know that a patient has an allergy until they actually react. So always be looking for those reactions. And if just because it's a mild reaction, such as they taste metal in their mouth, they feel warm, they start getting hives, that can, of course, always progress to a much worse or severe reaction. So just because we're seeing a mild reaction doesn't mean we can ignore it. We write it down, we document it, and we monitor that patient properly and make sure that that is not getting progressively worse. For example, they start having a few hives, like, okay, they have like 5 hives on their face, they're fine. You're not paying attention, 10 minutes go by, and all of a sudden their entire body is covered with hives because you didn't take it seriously, and they're going into shock all of a sudden because you're just like, oh, it's mild, it's fine. Any mild reaction has that capability and chance to worsen to a severe reaction. So never take a reaction for granted. A reaction is different from a side effect. It's two different terminologies. And like I just said, guys, always got to monitor that patient continually. Don't just walk away and assume they're okay. You are that patient advocate. You need to monitor them from the beginning of that exam, beginning of that injection, all the way to the end. And of course, cover your bases by documenting every single thing that happens to them, whether it's mild, moderate, and definitely, of course, severe. Don't forget that first bullet point there, guys. Most of those reactions that we're going to list here in a second will occur within that first minute of injection. Okay, and of course, like I just said, guys, we have our three categories of patient reactions. That's going to be mild, moderate, severe. Even though they are labeled as such, mild does not mean, once again, that it's just no big deal. Whether it's mild or severe, we're going to pay close attention to it and document it accordingly. Contrast via osmolality is of very particular importance in neonates and small children because high osmolality has a higher chance of causing major reactions in small children because they're still developing. I won't get into all the physics of that, but the way it transmits through the blood barrier with the osmolality, it's going to occur a lot faster in young children because they're still developing. Main point is contrast media osmolality is causes a lot more reactions in our small children and our neonatal premature infants because their systems are still developing. So we're definitely not going to use higher osmolalities on small children unless it's just an absolute emergency and we can't use anything else. It's just too much of a risk. We would opt for those low osmolality contrasts, non-ionic. Okay, there's a bunch here, guys, but we have to be able to pick these out because one thing your registry will do is they'll give you a list just like that on a question. They'll say, are these mild, moderate, or severe contrast reactions? Definitely something they like to ask about. So when we're talking about our mild reactions, they are listed right there for you. Of course, nausea, vomiting, cough, those warm feelings, very common. Almost every patient that you have that has a contrast injection will state that they feel warm all over. Sometimes they'll even say they feel like they're going to pee on themselves. Totally normal. Totally normal. Headaches and dizziness, quite common. Shaking, itching, strange taste in mouth. Particularly, most of your patients will say, I feel like I taste metal in my mouth. That's those common tastes that they will have. Pallor, flushing chills. Sweats and urticaria, also known as hives. Nasal stuffiness, one that we often look over. I mean, people say, well, they have a stuffed nose. That's no big deal. Everyone gets stuffy noses, but that is a specific mild reaction to contrast. Swelling around the eyes and face, and yes, anxiety. Anxiety is a symptom and sign of a mild contrast reaction. A lot of your patients will become quite irritable while they're having contrast injected into them. That is a real reaction. It's not because they're being grumpy or mean. That's a very common reaction to contrast injections. Escalated, of course, because most of your patients are sick, they're nervous, they don't know what this big machine is, they don't know what's going on. So that anxiety, of course, is going to get even worse. But something that you still want to document. People would overlook that. Oh, they're just grumpy. I'm not going to worry about that. That's normal. No, if they're getting grumpy and having anxiety during a contrast injection, you still want to write that down and document that because that is a mild reaction to that contrast medium. Like I said, probably your most common ones are the warm feeling, taste in the mouth, and anxiety. That's the top three I've seen contrast medium injections. When it comes to our moderate, a lot less to list here. We have our tachy and bradycardia. Tachycardia being that fast heartbeat, bradycardia being the slower heartbeat. Hypertension, a pronounced cutaneous reaction. Hypotension, dyspnea, bronchospasm, wheezing, and laryngeal edema. You don't even know what all those mean. Just know how to recognize those as moderate reactions. Probably the most common when it comes to moderate reactions is going to be tachycardia, bradycardia, hypertension, and hypotension. That's going to be the most common moderate reactions that we see. course, we have our severe reactions, the least amount overall, but of course, these are the major reactions that we do not want to see because these are the ones that could definitely kill a patient very fast if we don't recognize it happening. And those would be laryngeal edema. That's going to be when their throat swells up severely, they can't breathe, they can't talk, they choke. Convulsions, going into seizures. Profound hypotension, which can lead to cardiac arrests. Cardiac arrhythmias, complete unresponsiveness, and of course, the worst of all would be that cardiac arrest. All falling under that severe reaction category. And of course, do remember once again, guys, even the mildest contrast reaction can evolve to one of these severe ones if we're not monitoring it properly. Okay, so we're going to talk a little bit about our radiopharmaceuticals as well. Now, one key point here, look at that first bullet point. Do not mix this up. And this is a great question, by the way. A radiopharmaceutical is not a contrast agent, even though we do use it to light up certain organs and visualize them on nuclear medicine studies, especially. Do make sure you make note that it is not considered a contrast agent. It is considered a radioactive material, chemically attached to a pharmaceutical that is then metabolized in the body. So we make what we call radioactive isotopes and actually inject these into the body specifically for our nuclear medicine studies to light up some organs that are harder to visualize, such as the thymus gland, the thyroid gland, some of those more hard to visualize glands and organs. They're going to light them up using those radioactive pharmaceuticals and get a different type of visualization of it. If you've never seen a nuclear medicine study, it kind of looks like heat vision. Have you ever seen heat vision on a person where it lights up the heat? Same principle, very fascinating to see. If you ever get a chance to rotate through nuclear medicine, it's a very, very cool modality. If you want to go into nuclear medicine, it does require more schooling, a lot more schooling, but very fascinating field, very fascinating field. Very dangerous field because you have to handle radioisotopes, of course, not with your bare hands. You're using specialized gloves. You have glass in front of you, but pretty fascinating to watch and see. Now, another key point of those radiopharmaceuticals, they're going to light up those organs that we want to visualize using gamma radiation specifically. Gamma radiation being a very strong type of radiation, which can cause a lot of damage in the patient. Therefore, when we do our radiopharmaceutical injections, we have to be extremely accurate with how we place those in the body because they can cause residual damage around the surrounding tissues because of emitting that strong gamma radiation. Something else I didn't put here, but what's really important about these isotopes is they have to have what we call certain half-lives. Half-life is how that radioisotope will decay and be digested through the system, absorbed through the body system. If it doesn't have a certain half-life, if we do not create that isotope correctly, it can cause severe damage as well because we only want it to be in the body for a certain amount of time just to get that visualization of what we want to see and have it pass through that body as fast as possible. It can also be very effective when we're talking about cellular physiology assessments. We want to look things down at the cellular level in imaging. It's very, very, very effective. And one thing we have to always make sure we're very careful with, and when you get to rotate this area, if you choose to, this is something that you'll see when they're handling these isotopes. They're extraordinarily careful because contamination and spillage is very critical. We're handling extremely radioactive substances emitting extremely powerful gamma radiation. So if any kind of mistake is to occur, especially when it comes to contamination and spillage, they're going to have to shut that entire area down and clean that out as fast as possible to make sure that we're not irradiating everybody in that area. Because gamma radiation is quite powerful. Anyone here ever seen a nuclear medicine study? Anyone here? It's very cool. It's very fascinating. I will say, if you decide to go into nuclear medicine, you got to be an expert with physics and chemistry. You're going to become a physicist and a chemist all in one, because doing those isotopes is quite complex. It's also been combined a lot with CT, what we call PET-CT. Have you ever heard of PET-CT? PET-CT is a combination of nuclear medicine and CT machines. So when we talk about handling these radiopharmaceuticals, time is going to be extraordinarily critical, not only for the patients, but for us actually doing the imaging as well. Because if I remove a radioactive isotope, I got to get that in the patient as fast as possible, because as soon as I remove that isotope, it's going to start going into its half-life and decaying quite fast. And we want them to decay fast to keep patients safe, but we always have to be aware that time is going to be of critical essence to get it done very fast and avoid that complete radioactive decay. Always be aware of contaminations. You have to handle them very, 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 very carefully. And not only is it dangerous as far as irradiating everyone in the area, it can also produce severe image artifacts. Obviously, contaminations of gamma radiation would be emitting radiation. If we're trying to do imaging, that radiation is just shooting all over the place, screwing up our images, making them lower quality and making them undiagnostic. And of course, it's going to make that exposure go way up. Gamma radiation is quite powerful. And we have two types of contamination. We have external and internal. Of course, external would be, for example, if I'm handling an isotope and I drop it, it hits the floor, the glass explodes. I got to clear that area out because we got external gamma radiation shooting all over the place. We got to get everyone out of there. They got to call some people in to clean that up properly, get rid of that isotope, and clear that area of residual radiation. Internal contamination would be if I did not inject that isotope properly in the patient, or I did not give a patient an isotope with a proper half-life. It's just staying in those tissues for too long, or I put it in the wrong tissues and it's starting to irradiate the incorrect areas within that patient. So that would be an internal contamination. And there are ways we handle that as well. They can get that removed from the patient quite fast. There are some emergency procedures for that, but that damage can occur quite quickly. Just like I keep saying, gamma radiation is super strong. It's going to really affect that patient's tissues. So time is always, always of the essence when it comes to those radiopharmaceuticals. Another area of imaging, guys, that you'll see radiopharmaceuticals utilize would be, I lost my train of thought. Radiation therapy, where they use particle accelerators to combat tumors and cancers. They use these very high-powered electron beams combined with radiopharmaceuticals to try to eliminate tumors. Another really fascinating area of imaging that you can go into if you're interested in that. It does require more schooling. Quite fascinating, very cool stuff. Whenever I was in school, that was the big modality that was getting very popular. It was PET-CT and radiation therapy. Everyone was really migrating towards those fields because they were becoming very popular. It was newer technology, and typically those newer technologies everyone just runs to really quick to try to get into. Right now, it's still trending with IR. IR is like the big modality right now that everyone's trying to get into. Okay, so we always need to make sure that we are administering these contrast agents under the supervision of a licensed physician with proper qualifications, and that refers to the fact that we always want to make sure before we use any kind of contrast or radiopharmaceutical or whatever, we have the order from the doctor. Otherwise, we can get in big trouble. Also, the doctor can get in trouble if they don't sign off on it. It's always a really big deal. We always got to make sure that we do proper patient assessment and history, patient comfort and education. Let them know why you're giving them contrast, and don't ever call it dye. Just call it contrast. Always explain to them, hey, we're going to have you drink this barium, or we're going to inject this contrast. If they say why, well, we want to light up your organs so we can see them properly. You're here because you're having stomach issues. We can light up your stomach if you drink this barium. That's why we're doing it. They just want to know what's going on. Don't just say, here, drink this milkshake and good luck. Bad idea. Always be thorough. That's going to help the patient relax a little more, hopefully reduce that anxiety, and help them to be a lot more cooperative with you. And of course, guys, make sure you're recognizing all those signs and symptoms of reaction, act appropriately, and document appropriately, whether it's mild, moderate, or severe. Always keep in mind that even the mildest reaction can quickly evolve into a moderate or severe reaction. So we always got to be making sure we're paying attention to all those small details. It's a lot to remember. I mean, like I've said before, people always try to stereotype us as technologists, say, oh, all you do all day is push a button. We do so much more than just push a button. I mean, if we're just talking about contrast, period, there's so much just in the field of contrast that we have to be aware of and watch for and document and take care of. It's just so much more. So I always get so offended when people say all I do is push a button. Don't let anybody ever tell you that. You're not a button pusher. You're so much more than that. So much more than that. That's like my biggest pet peeve. In fact, my wife likes to troll me sometimes, say, oh, all you ever do is push a button, right? I'm like, that's my trigger word. Don't say that. Don't say I push a button. Okay, just a few more points, guys. Some points to study. In conclusion here, guys, these are some major points to make sure you're focused on. Of course, contrast materials are indispensable and a huge part of everything we do in medical imaging. It's a lot more than just simple x-rays. When we go into fluoro, when we go into CT, when we go into MRI, nuclear medicine, whatever, whether it's contrast materials or radiopharmaceuticals, they are a huge part of what we do in medical imaging, and we must be very knowledgeable of what they are, how they react to the patient, and make sure that we're always documenting everything properly, looking for those reactions, and being always careful and safe when we utilize them. Make sure you know about the contrast mediums being positive or negative, how they dissociate into those negative and positive ions. And make sure that big point there, I made this a big point last time, make sure you know that they rely very strongly on that photoelectric effect for contrast visualization. That's an absorption principle, absorption physics principle in relation to contrast medium. Also, the photoelectric effect is one of the biggest contributors, or it is the biggest contributor to patient dose when it comes to the physics principles. Our iodine contrast media, that would be our ionic contrast media. They can cause anaphylaxis. Why? Because ionic contrast media is going to cause a lot more reactions in comparison to the non-ionic contrast media. Why? Because ionic contrast media dissociates into two ions. That causes reactions or more occurrences of reactions, whereas the non-ionic contrast media does not dissociate into ions. Therefore, it is safer to use overall in trying to keep those reactions down in our patients. And that's what I just said right there. The non-ionic low-osmolality contrast agents are the gold standard of what we want to use. Not just for costs, not just for visualization, but keeping those patients safe. And of course, above all else, we want to keep our patients safe at all times. Radiopharmaceuticals, we use those in nuclear medicine and radiation therapy, and they're especially helpful for cellular physiology and perfusions, also for lighting up those organs that we cannot see easily on regular contrast studies, such as the glands. Thymus gland is a great example. Thyroid gland is another great example. It's going to light those organs and tissues up because we inject those radioactive isotopes into the patient and using an imaging device to better visualize those areas of the body. And of course, patient reactions, constant responsibility for you as a radiologic science professional. Never take it for granted. I always say you get some really lazy, terrible techs out there that just do not care. And I promise you, you don't want to risk a job like that. Something as simple as failing to document a reaction properly, or even looking up an allergy or quizzing your patient properly about an allergy can cost you your job. And the last thing you want to do in this career is lose your job. It is a small community. If you lose your job or get fired in this career, it's going to be very hard to find another job because word spreads very quickly. Everyone knows everybody in this field. It doesn't matter if you work at Harris Health, Texas Children's, Memorial, whatever. Everyone's going to know what's going on, and they're going to know if you're a good tech versus a bad tech, and you always want to set that bar high and pay attention to all these small details, even if it seems trivial, even if you're stressed out, even if your workload is just too much. You cannot take these small things for granted, and that's what's going to make you a quality tech over a low bar tech. And don't be a low bar tech. You're all going to be high bar techs. At least I hope so. That's my goal. That's my goal. So always pay attention to the small details, guys. I promise you it pays off. Promise you it pays off. And with that, guys, you have all just received your last patient care lecture. No more patient care from Mr. Donahue. No more patient care at all. With that being said, guys, please don't take patient care for granted. I know a lot of the information in patient care is more so on the easy side of things. A lot of it's common sense, yes, but I can tell you from personal experience, thinking back to my own x-ray registry, they're going to throw a lot of patient care questions at you. And if you forget about them, it's going to screw you over on your test. And you need every one of those points you can get. I can tell you right now also, I just did my CT registry, and guess what they had a lot of questions on? Patient care, patient care, patient care. They want to make sure you know how to take care of your patients properly. So never take that info for granted. Save your notes. Save all those points I've told you over this whole class, those gold star questions. I don't want that to mess you guys up because I want you guys to pass that registry the first time. And I will tell you, I think I've said this before, we get trends on the most missed questions on registries, and the ones that are missed the most are patient care questions because people take it for granted and they forget about it. Usually it's in the first 2 semesters and it goes in one ear, out the other. Don't forget your patient care info. And as we get closer to your registry, guys, we'll review it all. Make sure you know all those key points. Make sure that you are prepared for that test. All right, guys, that is going to wrap it up for today. Are there any questions on the material I just went over? All right, I apologize. I did not have time to put a little quizzes review together for this chapter. But if you focus on the PowerPoint, I'm going to send you the second part here. Focus on your PowerPoint. You will do well on your test on Friday. If you have any questions, please let me know. I'll clear anything up for you. Other than that, go study, guys. Go study your pelvis anatomy. Go study your pelvis anatomy. That test is coming up at 1 o'clock. Don't panic. You're going to do fine. You'll do fine. Study that anatomy. You'll do well, guys. Let me know if you have any questions. Stay tuned for the image review schedules I'll be sending out to you guys. If you need anything else, please let me know. If I've missed any of your messages, remind me. I've been getting emails. I got an email list this long, guys, and if your emails get buried, I apologize. I'm not overlooking you. Just remind me if you want something, if you had a question. Send me a text, whatever you're comfortable with. All right, guys, take care. Enjoy your next class. I will see you all at 1. Let me know if you need anything. Bye-bye.